Cyclospora: causes, symptoms, prevention, and treatment. And how Cyclospora is transmitted. Cyclospora is a microscopic parasite that causes an intestinal infection known as cyclosporiasis. People become infected by consuming food or water contaminated with human feces containing the parasite. Unlike many foodborne illnesses, Cyclospora cannot spread directly from one person to another because the parasite must spend several days to weeks in the environment before it becomes infectious. In the United States, outbreaks are most commonly associated with eating raw, fresh produce that has been irrigated or washed with contaminated water. Foods frequently linked to Cyclospora include leafy greens, such as romaine and iceberg lettuce, salad mixes, fresh herbs like basil and cilantro, and berries, especially raspberries. Produce grown close to the ground or on vines is particularly vulnerable to contamination through polluted water or soil. Symptoms and incubation period. Symptoms usually appear about 2 to 14 days after consuming contaminated food or water, with most people becoming ill approximately 1 week after exposure. The infection commonly causes watery diarrhea, abdominal cramps, bloating, nausea, fatigue, and loss of appetite. Unlike many forms of food poisoning that resolve within a few days, cyclosporiasis may persist for several weeks or even months if left untreated. Symptoms may also disappear and then return over time. Prevention. Although it is not always possible to prevent Cyclospora infection completely, several measures can significantly reduce the risk. Wash fruits, vegetables, and fresh herbs thoroughly under running water. Firm produce should be scrubbed with a clean produce brush to remove dirt and potential contaminants. Cook fresh produce whenever possible. Heating food to at least 158 degrees or 70 degrees effectively kills the parasite and is the most reliable method of preventing infection. Practice proper hand hygiene by washing hands with soap and warm water for at least 20 seconds before handling food and after food preparation. Avoid drinking untreated or unfiltered water, particularly when traveling to tropical or subtropical regions where Cyclospora infections are more common. Treatment. Most healthy individuals recover from cyclosporiasis without specific treatment, provided they remain well hydrated. However, antibiotic therapy can shorten the illness and relieve symptoms. The recommended treatment is trimethoprim-sulfamethoxazole, TMP-SMX, commonly marketed as Bactrim, Septra, Chas, or Cotrim. The usual treatment course consists of taking the medication twice daily for 7 to 10 days. For patients who are allergic to sulfa medications, healthcare providers may consider alternatives such as ciprofloxacin or nitazoxanide, although these medications are generally less effective. Because Cyclospora is a parasite rather than a bacterium, many antibiotics commonly prescribed for routine gastrointestinal infections do not work against it. When to seek medical care. Anyone who suspects they have a Cyclospora infection should consult a healthcare provider promptly. Diagnosis requires a specific stool test to identify the parasite. Appropriate treatment usually includes prescription antibiotics when indicated, along with adequate fluid replacement to prevent dehydration and support recovery.